A very good evening to Sir Izzuddin. My name is Purnima Madhavan. For the bandaging skill, the type of bandaging that I have chosen is the head bandaging. The head bandaging is for head injury. As you can see, the definition of bandaging is protective covering applied to the wound. There are few purposes for bandaging. The first purposes is that it creates pressure over an area. Secondly, to support and protect the wound from contamination such as bacteria and germs. As for the third purposes is to reduce the bleeding. Fourthly is to secure or splint or dressing. That are the purposes of the bandaging. Okay, for the bandaging skill, the type of bandaging skill that I have chosen is for the head bandaging skill. It's for the head injury. As you can see, this is the victim. The victim is having a head injury where I'll be using the gauze strip and also the roller bandage for performing the bandaging skill. So firstly, I would put the gauze strip as the pressure pad here. Can you please hold this? Okay. Now I would like to start the roller bandaging. Before I start, I'm already wearing my glove, as you can see. But the first knot and the second knot must be untucked, and then I'm going to use this roller bandage to cover the gauze strip where is the injury is, which means I am performing the anchoring side now. I'm not covering the ears of the victim. I'm gonna do for the second round of the bandaging. As you can see, I have crossed the bandage. And I'm gonna do another one more round to cover the gauze strip and also until the roller bandage finish. I'm going to tie the knot with the first knot. And I'm going to put the second knot. And that's all for the head bandage.
Good morning, sir. My name is Devashini Salman. So, I am going to talk about bandaging. Bandaging is an essential part of dressing which is necessary for all patients and also a method of supporting injured body parts. Bandaging an injury is done for a variety of reasons and it is a significant method for controlling and preventing excessive bleeding as well as treating injured bone fragments, muscles, and also many other more. Bandaging techniques of different Bandaging techniques of different types are sometimes used to reduce swelling and also provide support to an affected area. There are many types of wrapping where we need to determine the nature and the location of the injury. We can't simply put the same method of bandaging for all types of injuries. So, in my group, the type of bandaging that I have chosen is forearm bandaging. The forearm, which is located between the elbow and also the wrist, contains two bones, which is known as the radius and also ulna, which can also be cracked by a direct blow or a fall onto the extended arm. So this is because the bones have comparatively little tissue concerning them to soften the impact, and these injury problems may due to open fractures where the bone ends up protrude through the skin. While performing a bandaging for an injury on forearm, there is main material that can be used to perform this bandaging. And the very important equipment that someone needs is a roller bandage. This is the example of roller bandage. Okay, this roller bandage are long strips of material which is used to apply or to support a strain or a spring. They can be applied firmly but not too tightly because this might reduce the blood circulation. There are also few steps to actually perform this bandaging on the forearm. So, firstly, we need this elastic roller bandage or any suitable bandage to treat the injury. And then we need to begin wrapping with one hand holding the rolled up and also the roller bandage. We have to maintain the rolled portion of the bandage above the injury and the unrolled portion beneath the injury, and we need to start wrapping in a spiral and a circular motion. So we need to work the way up the limb, winding the bandage in a spiraling turns and ensuring that each new layer covers at least 33 to 66% of the previous one. So we have to complete the wrapping and also the bandaging again and safeguarding the closure. So we have to make sure the patient is feeling comfortable and it is not wrapped too tightly because if it's wrapped too tightly, it might worsen the pain of the patient. So we have to make sure to wrap and give a proper and a clean, good aid. Thank you.
process. So I'll be doing the demonstration of wrist bandaging. So the stuff that we need is roller bandage here, and of course the model. So okay, the victim sustained a wrist sprain on her left wrist. So what I'm going to do a bandaging in a style of figure of 8. So let's start. So first we make sure that the hand is like in this position. So what you're gonna do is put it here. Make sure that your bandage is not too tight and not too loose in order to secure the blood circulation. Then, yep, this is the figure of 8 that I'm talking about. And just continue the bandaging. Make sure that it is secure all over the place. And yep. So when you want to pin it, do check it and make sure that it is not too tight, and ask for the patient if it's comfortable. Is it comfortable?
Okay, yeah.
Alright, so then you can pin it, and yep. So here you go, figure of 8 of sprained wrist that you can see. If the victim has a larger hand, so you may use a larger roller bandage.
Hi, I'm Tanya Dion Abdurrahman, and today I will be showing you how to wrap an ankle. This is for sports management of an injury. So we have our elastic bandage or ACE bandage and our clip. So you want to start your wrap near the top of the toes, just where the toes meet the body of the foot, and you want to start wrapping, and you want to anchor it here so that it stays in place. Then you'll continue to wrap, and as I'm wrapping the bottom of the foot, I'm pulling it. This is 100% stretch, so I'm stretching it to about 50 and pulling it over. The reason why I'm pulling it a bit to 50% is because the swelling is going to be here around the ankle and the foot, and we want to push the swelling back up into the leg and away from the toes. So I continue to wrap until I get to about this part, then I can start figure 8ing. So when I wrap around the top part of his ankle, I'm not going to be pulling at 50% because remember, we want the blood flow to come up. So we'll start figure 8ing, covering the ankle, and one more time, making sure to pull at the bottom but not at the top. And you want to try to end your bandage at the top so that if the patient wants to put on a shoe or has some other limitations, it's easier to access. Then if your bandage does not have Velcro here, then you'll simply use the clips to hold it into place. Once you're finished, you want to check the toes. Can you feel your toes?
Yes.
Okay, so if they can feel their toes, and we also want to monitor the toes start to turn blue, then we've done this too tight and we have to reapply it. So now we stabilize it at a 90-degree angle, and then the patient can go home and elevate the leg using pillows, get some rest, and ice it 20 minutes a day, and then change the bandaging daily. That's it.